Hello, this is Lexus Denton, and today I'm going to be discussing three local drug treatment facilities and the programs that they offer. I'm going to, based on the research that I did, I'm going to be providing uh, just some general information about the services they offer, uh, about their payment options, contact info, and just a lot of the general information, a lot of the initial information that a person who is interested in receiving services would need just to get started and get admitted into the program or begin receiving services in the program. So, the first facility that I saw, in the first facility of the three different facilities that I chose, it's called Journey Pure Louisville Addiction Treatment Facility. Hopefully, you all can see that. It might be backwards. I'm not sure. I think it is backwards, so I'll just read. But it's basically called the Journey Pure Louisville Addiction Treatment Facility. It's located at 330 Newburgh Road, Suite 158, Louisville, Kentucky 40218. Their phone number is going to be 866-638-4218. So, the approach of the facility is basically divided into two different sections. The first section is going to be the sessions that they offer, which is the different therapeutic options that they have. And those sessions are going to be both they offer group therapy, individual therapy, medication evaluations, and life coaching. They offer both outpatient services. Well, it looks like Journey Pure Louisville only offers outpatient services. Uh, I wanted to talk about what that means. Basically, within drug treatment programs and facilities, you have inpatient services and outpatient services. Inpatient services, that is the traditional format of what people are going to think of when they think about drug rehab, which is a patient who's seeking to get clean from drugs and or alcohol actually is lives and stays on the campus of the facility. They eat there, they sleep there, and the whole time they're there, whatever the duration of time, whether it be a month, 2 months, 3 months, it looks like typically it's going to be one of those three amounts of time. The whole time they're there, they're focused on completing the drug rehab program and getting clean off of the substance that they're addicted to. So with that, you have the inpatient is being living on campus and being inside the facility. Outpatient is receiving services from the facility while still living at home. So you're reporting to the facility and you're utilizing services from the facility, but you're going home at the end of the day. You don't have to stay there. So Journey Pure Louisville only offers outpatient services, uh, which is unique. So how a person would get services, would begin receiving services, you have to have an initial new patient appointment where a comprehensive assessment is performed. And that basically means the medical staff, the doctor, the inpatient nurses, and the assessment specialist all conduct an assessment and see, okay, what chemical you specific chemical you're having issues with, whether it be drug, alcohol, whatever specific kind of drug, and then they develop a specific plan based on that assessment for you. And uh, that plan, as I said, is going to be specifics. It's an individual plan. So based on the person, based on the severity of the issue that they're having, uh, that's what is going to determine the amount of days and the amount of time spent while utilizing the outpatient services. The statistics that I found in my research, it looks like they have a 95% satisfaction rate. Now, with these statistics and the statistics in the other facilities that I did research on, I feel like a person needs to take those numbers at face value, meaning uh I'm not sure how one would vet those numbers. Obviously, well, not obviously, but I mean, it seems like it'd be in their best interest to provide really good numbers like that, a 95% success rate or satisfaction rate and or success rate. As I said, I've never been to Journey Pure and I don't know anybody who has, so I just take those numbers at face values, but that is the number that is on their website, a 95% satisfaction rate. And then if you Google Journey Pure, as far as the Google survey, they received a 4.5 star rating. So that's really good too. Uh, as far as, so that's the sessions portion of their treatment. They also have methods. Their methods portion is going to be CBD psychotherapy they provide, trauma informed care, motivational interviewing, and relapse prevention planning. So it looks like they provide therapy with CBD. Uh, it doesn't look like they have anything opioid specific like methadone or Suboxone or any of those different drugs. Uh, and maybe that's determined in the initial assessment where they uh, put together the individual plan. But all in all, like I said, they're located at 3430 Newburgh Road, Suite 158, 40218 Louisville, Kentucky. And their contact is 866-638-4218. Yeah, that's the general information that I was able to gather on their website. Moving on to the second facility, we got Landmark Recovery Louisville Drug and Alcohol Rehab. Now, this is unique because it looks like Landmark has multiple locations across the country. In the specific one in Louisville, so they have a specific one in Louisville, but not just in Louisville. They have several different locations across the country. The one in Louisville is going to be located at 4418 Malcolm Avenue, and that's 40218 Louisville, Kentucky. Their contact number is going to be 502-215-8521. So their approach, it looks like they offer both outpatient and inpatient services. So like I mentioned before, Journey Pure only had outpatient, meaning you can't stay at the facility. Landmark, it looks like you can. They offer inpatient and outpatient, so you can actually stay at the facility for up to 35 days inpatient services. So about the inpatient services, it's like I said, it's up to 35 days, and within those 35 days, the patient's going to be attending group therapy meetings, individual therapy meetings, and support meetings. To get services started, just like Journey Pure, it looks like you have to have an initial assessment, a comprehensive medical and psychosocial assessment, which are a lot of big words, but basically just, it looks like they not only look at your physical state, but they look at your psychosocial state. They take that into account. Looks like they're mainly focused on alcohol and drugs. As far as the treatment for alcohol, they provide AA meetings. With the inpatient services, They say that the inpatient services are specific for patients who are still detoxing. Detoxing meaning they're still dealing with withdrawal. It looks like the outpatient services are more so for people who are the patients that are stabilized from the detoxing uh, stage of the addiction. As for the outpatient services, they the patient's gonna attend multi-model support sessions every week, 3 hours a day for 4 days a week. So that one is already set. That's the schedule. It's gonna be 3 hours a day, 4 days a week for the outpatient services for people receiving services and still going home at the end of the day. Uh, they offer both session-based and medication-based treatment, meaning they do provide medication for addiction. And it looks like one of their marquee drugs is going to be one of their marquee medications is going to be Vivitrol. I'm probably pronouncing that wrong. It's Vivitrol, which is an extended release form of the opioid antagonist naltrexone. And that medication looks like it's opioid specific. It's specifically for patients who are dealing with opioid addiction. Their phone number is going to be 502-215-8521. And it looks like they also take private insurance, meaning a patient must have a PPO insurance plan or an HMO insurance plan. I'm not sure if I forgot to mention that with Journey Pure, but they also take private insurance. They didn't have a success rate as far as statistics on their website. They did have the Google survey, which they received a 4.5 stars. So that's good too. And that's them. The last facility that I chose is going to be RAC, Center for Recovery. RAC standing for Robert Alexander Center for Recovery. For the life of me, I did on the based on my research on the website, I was trying to find who Robert Alexander was. I couldn't find that person. I'm not sure if that's the president or the owner or what, but the facility is named after a Robert Alexander. I'm sure that person is of some relevance for the center to be named after him. But they're located at 130 Hope Street, Mount Washington, Kentucky. That's 40047. They are located in Mount Washington, but they provide services for Louisville residents and other surrounding areas in Kentucky. Let's see. The services are going to be residential inpatient, and that's going to be either a 30, 60, or 90-day period. It begins with, so RAC is unique because they don't provide any kind of medicational maintenance, meaning they don't provide any kind of medication to help with drug addiction to their patients after detox. So it looks like they do provide medication to help with detox symptoms, the withdrawal symptoms, but after that they don't provide anything like the drug that I mentioned with Landmark to help. That was the opioid antagonist. They don't provide anything like that. After the withdrawal symptoms, it's purely therapeutic sessions that they utilize that they allow their patients to utilize. They offer an intensive outpatient program, but this is unique too. A patient has to complete the inpatient program before they can utilize the outpatient program, as this allows the patient to ease their way back into a normal routine. That's what's on the website verbatim. To receive services, you must attend an initial assessment where individual schedule of days and times are decided, meaning based on that assessment, they will figure out how many days a week you have to come, or how many days a week you'll be receiving services, and the times you will. So their program, it looks like it starts with the detox, then you have to complete an inpatient, and then you ease into the outpatient services. So they're unique. It's kind of all in one. With the detox, they provide a comfortable, calm environment for the patient to begin the detoxification services and to relieve the symptoms that come with detoxing. Uh, after that after detox, patients continue to receive service through evidence-based therapy and comprehensive aftercare planning. It looks like they also take private insurance for form of payment. So it's called RAC again. That's Robert Alexander Center for Recovery, and they are located at 130 Hope Street, Mount Washington, Kentucky. They have a really unique program, in my opinion. Of the three, I'd say 100%. I'm most impressed with the Landmark Recovery Program just because they offer both inpatient and outpatient. And it looks like it's going to be the most. It's individual. It's specialized for the patient. So I feel like that's important, and I feel like yes, they just give their patients the most options. And based on my research, when it comes to drug addiction and receiving services, that individuality and specifications for patients is going to be important for their success, because every person's different and every person's journey to get clean is going to be different as well. As far as the question, are drug treatment programs successful? There is actual data available, and simply put, it looks like about 43% of people who begin a program are going to finish the program. So about a little bit under half of the people who start a program actually finish it. And then with that, there are some kind of sad numbers, which it looks like about 40 to 60% of people actually end up relapsing once they finish a program and get clean. But it's based on my research, it doesn't look like once you relapse that your whole journey to get clean is over. That's just a part of getting clean. It looks like that's typical for patients. A lot of patients, not all, are going to end up relapsing, but then they end up getting clean again, and they may relapse again. But eventually, once the person is able to be fortunate enough and blessed enough to complete their treatment program and actually get clean, they stay clean. When it comes to the options for getting clean and receiving drug treatment, that's what it basically is. In a nutshell, it's you're either going to utilize the services of a drug treatment facility, or you're going to quit cold turkey, which basically means you're going to quit without the assistance of a drug treatment facility, without any medication. You're just going to stop. And the statistics for that are low, but it is possible. It looks like people do that. So that is actually positive. So that is the information I found out on my three facilities, and I hope it was comprehensive and you all learned something. Thanks.